Okay, this is the fetal circulation. This part right here, this is called the placenta. This is the umbilical cord. And the contents of the umbilical cord are, you see here, red and blue. That's going to exit here. Two of them are blue and one is red. It's purple actually because it contains mixed blood. It's not blue like this. It's purple. So the purple is red and blue, which means it's mixed. So here are the blue, the red, and the red is the umbilical veins. Why did you call it a vein? Because it's moving toward the heart of the fetus. So we refer to the fetus, not to the placenta. We refer to the fetus. So obviously, the red is the umbilical veins that will take the oxygenated blood from the placenta, and the placenta should be attached to the endometrium, which is the innermost layer of the uterus. The uterus go like endometrium, myometrium is the middle, and then perimetrium is the outermost. So starting from the endometrium, from the arteries, to the red here. To the red here is the umbilical veins, which is the opposite of what we always see. The umbilical vein will move within the umbilical cord, and here you see it. This is the umbilical vein, and it will go to this little part right here, and this is called the ductus venosus. So ductus venosus is between the umbilical vein and the inferior vena cava, from which it will take it here. If you can come here, so up here, it will take it to the right atrium. From the right atrium through this, I'm passing through the foramen ovale. So from the right atrium to the left atrium, from the left atrium to the left ventricle to the aorta, and part of it will move actually from the right atrium. This is a normal route in fetus. From the right atrium to the right ventricle to the pulmonary trunk to the pulmonary arteries. But at the pulmonary trunk, there is a ductus arteriosus that will take the blood that escaped the route that we're talking about and go to the pulmonary trunk, and it will bring it to the aorta. So one more time, the oxygenated blood come from the endometrium, from the placenta, which is the red, moving within it. We have only one. There is only one umbilical vein. So the umbilical vein, which is red, which is the opposite of what we used to, because it's moving toward the heart of the fetus. So we still call it a vein, but it contains the oxygenated blood. Move within the umbilical cord. So the whole thing here is umbilical cord, and then it will exit. So the red is umbilical vein. Ductus venosus will take the blood from the umbilical vein to the inferior vena cava. From the inferior vena cava, it will take it here to the right atrium, through the foramen ovale to the left atrium, from the left atrium to the left ventricle. From the left ventricle, if you go like this, it will take it to the aorta. This is one route. How about some of the blood that escaped, instead of going through foramen ovale, it go from right atrium to the right ventricle. This is another route, but we will catch it anyway. It will go to the pulmonary trunk, leaving the right ventricle. Pulmonary trunk, ductus arteriosus will take it from the pulmonary trunk to the aorta. So both ways will end up going to the aorta. And as you see here, the blue, which is the superior and inferior vena cava, this is the deoxygenated blood from the fetus, and it will go to the right atrium anyway. And we said that you brought the oxygenated blood from the mom to the right atrium. So now you're mixing two, red from the umbilical vein and blue from the superior and inferior vena cava. So at this point, at this chamber, which is the right atrium, you have mixed blood. So you see here, the aorta is actually looking purple, and the pulmonary trunk is also purple. Why? Because the blood is mixed within the right atrium anyway. From the inferior superior vena cava from the fetus, the red, which is the umbilical vein, and ductus venosus, inferior vena cava from the mom, so it's mixed together. And as you see here, it will go down the aorta, ascending, arch, descending, and this is a descending, the purple right here, and it will end up splitting into right and left common iliac. Each one of those will give right and left internal iliac. I don't see it much, but from the internal iliac, you have two umbilical arteries. Why did you call it artery? Because it's moving away. The blood is moving away from the heart of the fetus. So you see two umbilical arteries that will enter here inside, and it will go bringing the deoxygenated blood to the placenta, to the mom. So this is what we need to know about the circulation of